You have certain rights and entitlements while participating in any of the home and community-based Medicaid waivers. The purpose of the Medicaid waivers is to help you participate fully in the community and lead a self-determined life. However, first it is important to understand how the disability community arrived where we are today. Acknowledging the past will help you and your family members advocate for rights and access to services in the future. While the Katie Beckett waiver is not currently available in Utah, the Katie Beckett waiver was instrumental in allowing individuals with disabilities to receive care and services outside of a hospital setting. In the time since the waiver has been established, more than 500,000 children have received life-extending medical care at home under the Beckett waiver. Improved medical technology and close attention from nurses, aides, and parents, all made possible by the funding, have allowed these children to grow up with improved health despite having significant disabilities. Katie, a 4-month-old baby, contracted viral encephalitis, leaving her partially paralyzed, unable to swallow, and barely able to breathe on her own. Her parents wanted to manage her care at home with a ventilator. However, insurance would only cover her care in a hospital or an institution. Her parents began lobbying politicians and bureaucrats. The case led to what is known as the Katie Beckett waiver. Katie Beckett's story gained the attention of then-President Ronald Reagan. Katie's situation showed the nation the absurdities of a system that will pay to care for a child in a hospital, but will not provide that child's family with the coverage and support they need to care for the child at home, even when the cost is much lower. Reach out to your state legislators to discuss the possibility of bringing this waiver to Utah. Waivers currently available in Utah can be found on the Utah Department of Health and Human Services website under Medicaid waivers. In addition to the Katie Beckett waiver, the Olmstead decision was instrumental for individuals with disabilities. Lois Curtis and Elaine Wilson were voluntarily admitted to a psychiatric unit in a state-run hospital. However, due to their disabilities, they remained institutionalized for many years after the completion of their treatment. They sued for their freedom, and the resulting Supreme Court decision benefited the entire disability community. The court indicated unnecessary institutionalization of individuals with disabilities is segregation, and thus discrimination under the Americans with Disabilities Act. This decision reshaped the Americans with Disabilities Act, or the ADA, and was the birth of supported decision-making for individuals with disabilities. The Olmstead decision is often considered the most important decision in the history of disability rights. It was instrumental in moving individuals out of institutions and into the community. Olmstead has also been found to apply to individuals when they are at risk of institutionalization. For instance, people using Medicaid waivers who had their hours cut and are at risk of needing to live at a nursing home or other segregating settings that are not institutions. Some cases involved sheltered workshops and segregated educational settings. Olmstead ruled that the state and local government must provide community-based services to those with disabilities when services are appropriate, the person does not oppose community services, they can be reasonably accommodated. The Olmstead decision and the Katie Beckett waiver made it possible to waive institutional care and to receive services outside of an institution in the community. Services are unique to an individual. For example, a person may live at home and only receive respite and support coordination, where another individual may need full residential and day support. As we look toward the future, advocacy is not always easy. In fact, it can be challenging at times. Advocacy requires knowledge, practice, and patience. There are multiple laws impacting individuals with disabilities. It is important to be aware of the different laws and their implications so you can understand your rights. In 1973, the Rehabilitation Act and Sections 503 and 504 were passed. The Rehabilitation Act applies to discrimination against people with disabilities by federal agencies or entities that receive federal funds. The Fair Housing Act in 1973 prohibits discrimination in housing and housing-related transactions because of disability. The Individuals with Disabilities Education Act, or IDEA, in 1975 provides protections in education. The Americans with Disabilities Act in 1990, or the ADA, expands the Rehabilitation Act, prohibits discrimination by state and local governments, and provides protections in employment and public places. The Olmstead Decision in 1999, Workforce Innovation and Opportunity Act, or WIOA, in 2014, provides supports to transition-aged youth for competitive integrated employment, and the Settings Rule in 2014 to guarantee Olmstead implementation in HCBS waiver settings. For questions regarding disability legislation and how you can get involved, reach out to the Utah Parent Center.